All right, today we're going to talk about hyperlipidemia. Now, that's a big word, but it boils down to something that affects millions of people, often completely silently. We're going to break down the science of inherited high cholesterol and, really uncover why understanding your personal risk might be one of the most important things you can do. So, let me just start with a question for you. What if the biggest factor determining your risk for a heart attack wasn't your diet or how much you hit the gym, but something that was just handed to you, a kind of genetic switch that was flipped the moment you were born? Well, for millions of people, that's not a hypothetical at all. It is their reality. And the reason why is a process called atherosclerosis, basically the hardening of your arteries. It's often driven by a genetic flaw that causes sky-high cholesterol. And the scariest part? It works completely silently, building up damage over an entire lifetime. So to really wrap our heads around this, we first need to understand the threat itself. I mean, what is this silent process actually doing inside our bodies? This right here is atherosclerosis. So imagine your arteries are like these super clean, flexible hoses. Atherosclerosis is what happens when gunk, this sticky plaque made of cholesterol and other stuff, starts building up on the inside walls. Over years and years, that buildup hardens and narrows the pipes, choking off blood flow. And if a piece of that plaque breaks off, it can form a clot, block an artery completely, and bam, that's a heart attack or a stroke. Now, you're probably thinking, okay, how does all that cholesterol get there in the first place? And to answer that, we've got to look at our body's amazing and pretty complex transportation system for fats. You can really think of it as a biological superhighway. So how on earth does fat travel in our bloodstream, which is mostly water? I mean, it's like oil and water, right? They just don't mix. Well, the body has a brilliant solution. It packages fats, like cholesterol, into these special particles called lipoproteins. Just picture them as the body's little fat delivery trucks, cruising through your bloodstream, dropping off cholesterol wherever it needs to go. And these delivery trucks, they run on two main routes. First, you've got the exogenous pathway. This one handles all the fats coming from the food you eat. But then there's the endogenous pathway. And this is the one that surprises a lot of people. It's all internal. Your own liver is basically a cholesterol factory, working 24/7, making the stuff and sending it out. And that's a critical point. Your cholesterol level isn't just about what's on your plate. Your body has its own continuous internal supply. Okay, so that's how the system is supposed to work. But now we can get into what happens when that system has a critical, built-in flaw, a flaw that's literally written into your genetic code from day one. Take a look at this number, 1 in 250. Just let that sink in for a second. We're not talking about some super rare 1 in a million disease here. This is the prevalence of a serious genetic disorder that's hiding in plain sight. That's how common familial hypercholesterolemia, or FH for short, is. It's a genetic condition that causes dangerously high levels of LDL, what we call the bad cholesterol, right from birth. For people with FH, the body's entire cholesterol regulation system is fundamentally broken. And here's the official clinical definition. It sounds complicated, but let's break it down. Autosomal dominant is key. It means you only need to get one copy of the faulty gene from just one of your parents. And the result is exactly what it says, a lifelong, constant, high level of LDL cholesterol that leads directly to heart disease, way, way too early. So where's the glitch in the system? Well, in a lot of FH cases, it's in the LDL receptor. Remember those delivery trucks? The LDL receptors are the loading docks, mostly on your liver cells. Their job is to pull those LDL trucks out of the bloodstream. But in FH, these loading docks are broken because of a genetic mutation. And get this, there are over 1,600 different ways they can be broken. The result is always the same. The LDL cholesterol just keeps circling in the blood, building up and up to really dangerous levels. So if this is such a hidden risk, how do doctors even find it? Now, let's be super clear. This next part is not about diagnosing yourself. It's about pulling back the curtain on the fascinating detective work that medical professionals do to piece this whole puzzle together. It's pretty wild, but a lifetime of extremely high cholesterol can sometimes leave visible clues on the outside. Clinicians are trained to look for things like tendon xanthomata. These are literally cholesterol deposits that you could feel on tendons, like your Achilles tendon or on your knuckles. Another is arcus cornealis, which is a white ring around the cornea of the eye. If a doctor sees that in someone under 45, that's a major red flag. And you might also see xanthelasmata, which are yellowish cholesterol deposits on the eyelids. But these physical clues are just pieces of the puzzle. To really formalize a diagnosis and be sure, experts use a kind of scoring system. The one that's considered the gold standard is called the Dutch Lipid Clinic Network Criteria, or DLCN for short. It's a really methodical way to weigh all the evidence. Here's how it works. The system assigns points for different clues, and check out how heavily weighted the physical signs are. A patient having those tendon xanthomata we just talked about, that's a massive 6 points right off the bat. An arcus cornealis before 45 gets you 4 points, but family history is also absolutely critical. Knowing a close relative had early heart disease or those physical signs adds crucial points to the score too.
But the real heavy hitters, the things that can almost single-handedly confirm it, are the lab results and the genetics. An extremely high LDL level, we're talking 8.5 or higher, scores a whopping 8 points. And finding a known gene mutation through a DNA test, that also scores a massive 8 points. These are basically the smoking guns that can seal the diagnosis.
So the clinician just adds it all up. If the total score is over 8 points, that's considered a definite diagnosis of FH. 6 to 7 points means it's probable, and 3 to 5 means possible. See? It's a really structured way to combine family history, the physical exam, and lab work to get to a very confident diagnosis. Okay, I know, hearing all of that might sound a little intense, but here is the really, really good news. Even though FH is genetic, today we have an incredible and growing arsenal of treatments to manage it, and manage it really effectively. We can't change the genetic code, but we can absolutely treat its effects. The modern strategy is all about a multi-pronged attack. It usually starts with a high-intensity statin to slow down that cholesterol factory in the liver. Then, a drug like ezetimibe can be added, which works by blocking cholesterol absorption from your food. And then there are the heavy hitters, PCSK9 inhibitors. These are powerful injectable drugs that basically free up more of those LDL loading docks we talked about, which lets the body clear out massive amounts of bad cholesterol from the blood.
And you can really see the power of this combination approach right here. A high-intensity statin on its own, it's great. It can lower LDL by about 50%. Add ezetimibe to the mix, and you can get up to a 65% reduction. But look what happens when you combine a statin with a PCSK9 inhibitor. You can get an incredible 85% reduction in LDL. For someone with FH, a drop that huge is literally life-changing.
And the science is not standing still, not by a long shot. There's some amazing new stuff on the horizon. A drug called inclisiran actually works by silencing the gene that makes the PCSK9 protein, and it only requires a couple of injections a year. Then there's bempedoic acid, which gives doctors another way to block cholesterol production, which is fantastic for patients who might not be able to tolerate statins. The future here is really, really bright. So we end up right back where we started, with a question for you. Knowing your cholesterol numbers is absolutely vital, of course it is, but for a genetic condition like FH, that's really only half the picture. You also have to know your family story, because sometimes the most important clue isn't in your own blood work, it's in your bloodline.